Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about alternative methods to help explain and treat medical conditions and to help you achieve and maintain health. A couple of shows back, I talked and explained to you how obesity is literally killing millions of Americans. I went over a lot of scientific data that shows that because of what we are eating and how much we are eating, we Americans are literally eating ourselves to death. But an even more revealing statistic was that we are not simply dropping dead of these heart attacks or strokes, but rather we are acquiring these dreaded diseases, but then we're living years trying to fight these diseases, which of course end up costing our society hundreds of millions, if not billions of dollars. During the research for that program, it became clear to me that so many people are truly trying to lose the weight, but for whatever reason simply haven't been able to find a program that can work for them. So in our last program, we turned to a relatively new type of program that has only been in the US for a couple of years, and I introduced you to HCG. HCG is a hormone produced during pregnancy that literally pulls the stored fat from the body and uses it as energy. These new weight loss clinics are literally popping up all over the greater Houston area and indeed the country. However, there's one important point that I need to reiterate about the HCG program, and that is it should really be done under the supervision of a medical doctor. The reason for the medical supervision is due to the potential for side effects. So if there were to be a side effect, if one were to occur, which is very rare, the patient would want to have a trained medical professional who knows exactly what they're doing and how best to render treatment for whatever side effect has occurred. Regardless of the program someone uses in their efforts to lose weight, the primary concern should be to become more healthy. And speaking of health, let's define what I believe health really is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and processes of the body. It is the harmony of the 12 systems of the body that allows the body to function in a healthy manner and hopefully prevent disease. Again, this show has been designed to provide you with information that you can use to be better informed about achieving and maintaining your health. Many times there are alternative methods available for a given condition, and it is my desire to inform you about these treatments and therapies as we all strive to seek better health.
It's exciting and bold, yet classy and comfortable. It's the Tom Felicia Home Collection that puts the finishing touches to your perfect living environment. James Craig Furnishings in Houston offers the Tom Felicia Home Collection, along with other fashion-forward home furnishings, fit for every lifestyle. They offer the designs you want and the service you deserve. Visit James Craig Furnishings.
Welcome back. Today in the news, at the National Lipid Association's 2011 scientific session, senior investigator Dr. Preston Mason from Brigham and Women's University in Boston presented new data as to why two different types of essential fatty acids, which are both components of omega-3 fatty acids, have different effects on LDL cholesterol. Those two components are EPA and DHA, and even though they are found together in most every environment, they act very differently. The main reason for this study caught my attention is because it clearly demonstrates how someone could use a study to undermine or slant a view in one direction or another. You see, in most medical communities, without research, most treatments are considered invalid. So if someone wanted to prove that supplementation with essential fatty acids didn't help lower cholesterol, they could only use DHA, which is an essential fatty acid, and prove scientifically that the essential fatty acids don't work to reduce cholesterol. Now, obviously, this study would be a false study, but nonetheless, it would be reported, and many people who might have benefited from taking essential fatty acids may not take it, and that in turn could harm the person. The bottom line is simple. When you read a study, make sure you understand the motives and especially who is funding this type of study and research. In another news report that is truly amazing to me, it has been reported by the medical director of the British Heart Foundation, a Dr. Peter Weisberg, that it might be possible for the heart to repair itself after injury, and that they have discovered a protein that seems to stimulate this process. According to Dr. Weisberg, and I quote, "We always have believed that the heart has no capacity to heal itself, but this research suggests that this is not the case and the heart can repair itself. Apparently, the cells that are capable of healing the heart are already present in the heart in an area called the epicardium." For me, this is truly amazing research because up until now, if anyone had a heart muscle damage from, say, a heart attack, their only chance of new tissue was thought to be from stem cells, and we all know about the controversy surrounding the cells and the research there. But now, it's been discovered that the heart may be able to repair itself. But here again, there's a story inside the story. Medical scientists and research really don't know what the body is capable of, and that is true today, may not be true tomorrow. It reminds me of a movie released in 2004 called Something the Lord Has Made. It starred a man named Alan Rickman and Mos Def. It was a terrific, true story about a medical surgeon and his assistant who discovered how to operate on the heart. You see, up until then, before their research in the 30s and 40s, medical doctors believed that you absolutely could not operate on the heart. It was something the Lord made, and that was that. Well, thank God that we have researchers and that they keep looking for the incredible things that the body is capable of doing. And in our last piece of news, it will come as no surprise to anyone that I have found yet another piece of research that again shows how exercise can assist patients with some dysfunction or disorder. In this case, we're talking about resistance training and how it can improve the symptoms of generalized anxiety disorders, or GAOs for short. According to the American College of Sports Medicine at its 58th annual meeting, patients with a GAO tend to be physically inactive, but when they become active, they have a reduction of all of their symptoms. This study showed a 60% improvement using resistance training for those participants in the study group. Again, for those who are regular viewers, it will come as no surprise that exercise is beneficial for all people, regardless of their condition and any condition they might have. So for all of you sitting out there on your couches, not exercising, and using an excuse that you have some sort of medical condition, I would really suggest that it is just that, an excuse. So please, for your own health, get up and move. We're going to take another short break, but when we return, we're going to look and do something a little different for today's show. Today we're going to examine some additional medical news that has come to my attention, but this time we're going to be taking a more detailed look at what science has to offer in the way of helping us all live a more and better and healthier life. So please stay tuned.
poisoning affects over 1 million children today. If your home was built before 1978, your kids could be at risk. Log on to leadfreekids.org or call 800-424-LEAD.
Welcome back to Better Health. I'm Dr. Stowe. Before we dive deeper into some of the medical research crossing the wires today, I'd like to start with a little lesson on biology. What I'd like you all to understand is that we as humans have been on this planet for a very long time. Depending on which research you believe, genetically, we are between 50,000 to over 1 million years old, again, from a genetic standpoint. The reason I start the show off today by telling you this is because of all the research is really trying to tell us our cells genetically are over 50,000 years old. They've been programmed from the beginning of time, and that program tells our cells what to do, why to do certain things, just like a computer program does. Now, some of you might be asking, what am I talking about? Well, it's quite simple. If our cells and the way they function is over 50,000 years old, it shouldn't take a rocket scientist to understand that trying to change something that is 50,000 years old, you're going to meet with some substantial resistance. And that is one of the things that I believe is happening to us today as humans. We, as humans, used to be hunters and gatherers. But over the last 100 years or so, we've moved indoors. There's a convenience store on every corner. There's a restaurant every 500 feet. And much of the food we eat today is processed. It is not complete and it is not nutritious as it was in the past. So is it truly any wonder why we are sick and what we are taking in and what we're doing, it's not helping us? At 50,000 years old, our cells are finding it very difficult to function. And our society, we don't move because we're all working indoors. We don't drink enough water because we've been told we have to drink this fancy sport drink. And we put things in our mouths that the body has no idea what to do because it's all processed. So with this understanding as a backdrop, over the next few minutes, let's look at what scientists are finding as new research looks and tells us what diseases are being caused by. The first article I want to explore is a report from the World Cancer Research Fund and the American Institute for Cancer Research. Released on May 30th of 2011, this new report confirms that red meat and processed meats increase the risk of colorectal cancer and that foods containing fiber protect against this type of cancer. This report estimates that over 45% of colorectal cancer cases could be prevented if people consume more fiber-rich plant foods, consumed less meat and alcohol, became more physically active, and maintained a healthy weight. This report goes on to say that by changing to this more nutritious diet, this could prevent more than 64,000 new cases of colorectal cancer in the U.S. every year. So what is it about this report that I found so important? Well, first, it takes me right back to the beginning, and the beginning is where and when we were hunters and gatherers. What did we eat? We ate plants, fruits, fish, some meat. This is our natural diet. The one we were eating 50,000 plus years ago and up until just about 100 years ago. It is the same diet that has allowed us to develop and conquer the vastness of our planet. But over the last 100 years or so, we've turned from what made us who we are into the sickest group of people on the planet. There's also a part of the study that was problematic to me, and that is about the issue of meat. I have to tell you that I'm an omnivore. That is someone who eats plants and animals, and I do love a good steak. But the problem isn't that I love and eat meat. The problem is the meat itself and the way we in the U.S. get our meat today. There's a book I'd like to recommend called The Omnivore's Dilemma by Michael Pollan. This is a great book, but I have to warn you that it is a life-changing book. Mr. Poulin goes to great lengths and does a huge amount of research to bring to his readers the true facts of how our meat is processed here in the United States, and it isn't a pleasant picture. But it is one that I believe is worth reading because it will really explain how and why we are getting and staying so sick in our society. The bottom line of this report is that we all need to return to our roots and be very aware of what and how we are eating in order to stay and have a healthier life. The next report we're going to look at involves two different studies on vitamin D, which is a topic I reported on a few months ago. As you probably know, the body changes sunlight into vitamin D, and it is used in a variety of ways. However, a deficiency in vitamin D can have devastating effects and cause such diseases as cancer, multiple sclerosis, pain, respiratory infection, sinusitis, periodontal disease, rheumatoid arthritis, hypertension, fibromyalgia, cardiovascular disease, depression, and that's just a few. So this first report speaks to patients with chronic obstructive pulmonary disease, or COPD, and states that patients who received a high supplemental dose of vitamin D showed significant improvement in respiratory muscle strength and exercise capacity. The dose that was used was 100,000 international units for 3 months without any reports of side effects. But then in another report by the Endocrine Society published in the Journal of Clinical Endocrinology and Metabolism, this report reveals that it believes to be the treatment protocol for the prevention of vitamin D deficiency, especially for those at risk. Now, this was quite a lengthy report. It didn't go into everything. I can't go into everything that I believe is wrong with the report, but I can tell you that in one paragraph, they state the doctor should screen only those patients that they believe are at risk for vitamin D deficiency. But then in the very next paragraph, they stated that vitamin D deficiency is very common in all age groups and that essentially everyone is at risk for a vitamin D deficiency. I have to tell you that as I read the report, it was very confusing. Even if their recommendations are followed, the dose they recommended to treat vitamin D deficiency is about half the amount that the people in the previous report were given as a means of treating COPD. My main concern is this: why are we talking about supplementation with vitamin D in the first place? And the answer is quite simple. We have been told for years that we are to stay out of the sun because it causes melanoma or cancer of the skin. But does this make sense in the light of science? Yes, skin cancer can be caused by the sun, and yes, people do die every year from melanoma. But let's look at two aspects of that issue. First, the science about skin cancer. According to the National Cancer Institute, 68,130 new cases of skin cancer were reported in 2010, with 8,700 people dying from melanoma. Now, if you or a loved one have melanoma or someone has died from melanoma, of course that is a terrible event. However, 8,700 deaths out of approximately 300 million U.S. citizens is such a very small number. But I know what some of you out there are thinking. These deaths, the people who have died from the diseases I named earlier, these other people who are staying out of the sun are getting the cancers, the cardiovascular disease, depression, hypertension, and others. How many of these people have died because they've stayed out of the sun? The true answer is we don't know. But that leads me to my second issue, and that is our genetic makeup. Remember, as hunters and gatherers, we were meant to be outside in the sun. This, in my opinion, is where we should be getting our vitamin D from, not some pill. But now I can hear some of you out there saying, what about the skin cancer and the melanoma? And my answer is, if you're fair-skinned, if you burn easily, if you have a family history of skin cancer or melanoma, then by all means you should avoid the sun. However, for the remainder of us, the sun is our friend. Only a very small percentage of people will get skin cancer, and even smaller percent pass away from this disease. But a huge number of people are being harmed by their avoidance of the sun, and they are developing many diseases that are robbing them of their health and their lives. My advice is to be cautious, but don't be afraid of the sun. My last topic actually deals with a problem that has been known for quite some time, but unfortunately, little has been done to solve the problem. Before we get into the news article, there is a published report called Death by Medicine. It was published by a Dr. Gary Nunn, PhD, and Carolyn Dean, MD, and several others. I would ask anyone with an interest in healthcare to Google this report and read it for yourself. It is an unbiased look at what modern medicine is and is not doing in our society. For now, let's look at 3 research reports that relate to drugs. First, from the American Medical Association, the AMA, it reports that prescription painkillers are among the top medications sending patients to hospitals, and that the White House plans on mandating physicians to get training in prescription of opioids. The report goes on to say that the number of hospitalizations due to medication side effects has jumped by more than 50% from 2004 to 2008, and that a total of 2.7 million hospital stays were attributed to prescription drugs and their side effects. Our second news release, this time from the Food and Drug Administration, is telling medical doctors to closely monitor their patients who are diabetic and receiving a drug called Victors, because this drug has been found to cause thyroid tumors and pancreatitis. According to the drug manufacturer, many doctors who prescribe this drug are not fully aware of the serious risk associated with the use of Victoza. And our third report comes to us from the Archives of Internal Medicine. Now they are coming out with new criteria to help define what drugs are not appropriate and actually increase the risk of adverse side effects in older patients. They report that during a 4-month period, more than 25% of patients admitted to a teaching hospital had an adverse side effect from at least one prescription drug that they were taking. So what am I really talking about here? All these different related news articles about drugs? The fact is that all drugs have side effects. From a historic standpoint, almost all early drugs were made from a natural product, and then the pharmaceutical company changed the structure of the natural product into a synthetic and came up with a patent that allowed them to control and sell that drug. But the problem isn't because it is a synthetic, it is generally not well handled by the body. It doesn't mean to say that all drugs are going to cause dangerous side effects or that we don't need pharmaceutical drugs. The fact is we do. But what I'm trying to explain is that we as individuals have a responsibility to ourselves and our loved ones to educate ourselves on the potential side effects of a given drug that we might be taking, to be sure that if a side effect occurs, we realize what it is and contact our prescribing medical doctor immediately. We all have a personal responsibility for our own health. Our medical doctor is not going to intentionally give us something that he knows would harm us. But patients and their families have to be the ones that are diligent and understand that the potential side effects and then report them as necessary. We as Americans, as human beings, know so much about our bodies, but we also have to learn a lot about our bodies and what they're actually capable of doing. It is up to each of us to educate ourselves in order to become and stay healthy. The information is out there. I have and will report on as much as I can, and the internet is a good starting source of information. But the bottom line is that we have to become personally responsible for our own health. We have no one else to blame as we become a sicker and sicker nation except ourselves. There's one more segment to our program, and it's called Ask the Doctor. This is where you, the viewing audience, can ask me questions. So let's take one last break, and we'll be right back.
Any questions?
What kind of service plan does this come with?
Unlimited.
Can I keep my same phone number?
Absolutely.
How do I change the ringtone?
Just hook it up to your computer.
Does it have a camera? What's the warranty? Does it come in silver? Can I put my party shuffle on this? Does it have a 3.5 millimeter headset jack? You sell a lot of these?
It's the one I carry.
You ever get those phantom vibrations in your pocket?
Any questions?
No.
Are you sure?
Yeah.
Ask questions. For the 10 questions everyone should know, go to ahrq.gov.
Welcome back. Last week's segment on HCG gathered a lot of attention from our viewing audience. Some wanted to know where to find HCG clinics, others wanted to know exactly how much it costs, and still others wanted to know where they could learn more about this type of treatment for obesity. All these were good questions, but let me address them all by saying that this is just one type of weight loss treatment, and it may or may not be right for each individual. I can only make a couple of general recommendations about using HCG. First, find a local clinic because you will be weighing in at least once a week at that clinic. Second, make sure the program is under the supervision of a medical doctor. And lastly, please understand that if you choose this method to lose weight, you are also making a commitment to change your life from the way you were eating today to the new way the clinic will teach you to eat. If you are unwilling to make a new and complete lifestyle change, then you probably are just wasting your time, energy, and money. HCG or any other method of weight loss is only a stepping stone that assists people who have bad eating habits. For those willing to change those habits, probably almost any weight loss program would work. You just have to start and stay with that program, which should lead you to a longer and healthier life. Well, this ends our episode of Better Health. I hope you've enjoyed the show. It is my desire to help educate individuals about a variety of methods and conditions that can treat different conditions outside of the conventional medicine. I should also state that I am in no way making any type of diagnosis for any condition. All of the comments on this show are for informational purposes only. Any condition that you have or think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me any questions you might have regarding today's topic or any other health-related topic that you might have. Just send me an email to hcctv@hccs.edu, and as time permits, I'll answer your questions on air. Until our next show, take care, enjoy life, and live healthy.